Meghalaya government has started training the doctors to ensure enhanced surveillance of the human metapneumovirus Hmpv in the state. Health Department's Principal Secretary Sampath Kumar said that severe acute respiratory infection and influenza-like illness cases are also being observed following the Hmpv cases that have been reported in the country. Making it clear that there is nothing to worry, he added that if anyone develop flu-like symptoms, they have to be careful and ensure that they do not spread the virus.
As I said, we have been training our doctors on how to actually have more surveillance. Because basically we have this SARI and ILI cases, we are observing them and seeing that those samples are also being tested so that any Hmpv kind of things are there or not. So that's a process has been there. There is a proper system is there and we have been. But only thing I just said, if they have any flu-like symptoms, they have to be careful in terms of actually to see that they are not spreading to others.
The Social Welfare Department is seeking the intervention